Jean-Pierre Daubois felt the impact of the first wave of COVID-19. He lost his mother, Anna-Josée Mackay, in a long-term care home ravaged by the virus, and he's worried that could happen again.
What do you do not to have your own medical system falling apart from inside?
He's part of a proposed class action lawsuit against the home and the health authority, alleging they didn't do enough to protect residents as the virus spread. Long-term care and private seniors' homes struggled early on in the first wave with a lack of protective equipment, insufficient infection control, and a critical shortage of staff.
Every one of us, each day, can make a big difference.
Now, the government says it's made changes to be better prepared, including hiring and training thousands of orderlies for long-term care homes and tightening up infection control. Still, the virus got into this private seniors residence in Laval. It had 6 cases during the first wave. Today, it has more than 20.
In the first wave, we did everything we could. Right now, we're still doing everything we can. So, once again, it's a sneaky disease, and you really got to be careful.
It's one of a growing number of private seniors' homes where residents are more autonomous than those in long-term care dealing with outbreaks.
Comment on peut contrôler?
Quebec's health minister says the key is to monitor and control them. The government recently limited visits in long-term care homes in the most affected regions, and in private seniors' residences made masks mandatory in common areas. But this patient advocate says he'd like to see more measures like staggered dining times, not just masks.
I think it is the minimum that we could have. I know it is very harsh for people, but perhaps it will be the only way that we could save their life.
Daubois says he'd like to see more measures, too, to prevent more deaths like his mother's. Alison Northcott, CBC News, Montreal.